joining us today. I know that everyone has a super busy schedule, especially with the situation and the environment that we're in today. So we really appreciate having everyone here to listen in on this webcast. So today we're going to talk about some of the best practices to engage Asian American, Native Hawaiian, Pacific Islander communities in light of COVID-19 and the new Census 2020 field operations environment.
So hello everyone, my name is Julie. And for starters, we wanted to just thank everyone that is taking the time out of their schedule to listen into this webinar right now, especially because I know you all work in the health center industry, and I know at this time things are really hectic and busy and there's a lot of things happening. So I for starters want to say thank you for your hard work in this field. Without you, we wouldn't be able to, even address the COVID-19 issues and support all of the people and the patients that are going through this right now. So thank you for that. And yeah, again, we just wanted to say thank you very much for tuning into this call.
Right, so here are some of the issues that we're going to touch upon today. So first, of course, we're going to acknowledge some of the COVID-19 issues and how that's going to impact census work. Some of the barriers that already exist for census work when it comes to reaching out to AANHPI communities, what the census is and why it's so important, confidentiality concerns regarding the census, messaging tips on how to do outreach, how to fill out the census, and of course the non-response follow-up period.
Mm-hmm. So with COVID-19, as it has continued to kind of rise in the critical need to address it, a lot of the work that we are doing right now as Advancing Justice LA has moved to an online method. So a lot of the things that we are doing and a lot of our partners are doing is outreaching through media messaging and outreaching through messaging around safety for our communities, especially the Asian American, Native Hawaiian, and Pacific Islander community. I'm sure you may all have kind of heard in the news about spikes in hate crimes for Asian Americans and Native Hawaiian Pacific Islanders due to the COVID-19. So we wanted to take this time to just kind of acknowledge some of that fear and that concern about potential crime happening or hate crimes rising, either for you or for any of the clients that you are working with. And in recent news in regards to the census, a lot of community members have kind of started to feel less inclined to fill out the census because they're afraid of what that might look like, of potentially being targeted by people or being attacked because they are Asian American. And so we wanted to just kind of recognize that that is something that is happening and is really critical in this moment. And so some of the things that we do have right now is on our website, standagainsthatred.org. It's kind of a resource from our affiliates that we have to report hate crimes that are happening for our community members. And essentially it's here to kind of help educate the community and document hate crimes that are happening and recognize what it looks like, when it happens, and different ways that we can avoid it. And at the same time, this resource is used to kind of build kind of a collection of data and information for us to use to advocate for our safety and protection during situations like this. And so if you or any of your clients that you are working with are facing any of these COVID-19 hate crimes, please feel free to submit a story onto our website here at standagainsthatred.org, and we'll use that data to just kind of develop advocating policies to protect us. Other things that are happening that we are doing in regards to the census is that Lana and the Advancing Justice team has been working on different PSAs, videos, like how to fill out the census resources online for our community members to kind of have access to in the safety of their homes. And so a lot of that resource we will list at the end of this slide, this PowerPoint, for you all to kind of reach out to and use with yourself and your communities. But yeah, so again, for all of you that are working in the healthcare industry, we wanted to say thank you so much for all of this work, because I know it is a very difficult position to be in, especially figuring out your daily job, but also how to do all of that on top of COVID-19 while also finding ways to message about the census. So we wanted to say thank you for that, and we are here for with resources for you all to use. But yes.
Right. So I'm going to go into a little bit about who make up the hard-to-count communities. So hard-to-count communities are typically people that are difficult to outreach with information about the census or to get them to fill out the census. And these kind of communities are usually racial and ethnic minorities. The one we focus on is AANHPI communities, renters, people with limited English proficiency, immigrants, people forget to count small children and seniors. And a lot of these aren't exclusive. You can be an ethnic minority and a renter and an immigrant and limited English proficiency. So that makes them even more difficult to count. Yeah.
And so the reason why a lot of the Asian American, Native Hawaiian, Pacific Islander is affected by this is because they do fall into those categories of hard to count. And based on the 2020 Census Barriers, Attitudes, and Motivators study that we did, that was done by the Census Bureau, Asian Americans were the least likely. About 55% of them stated that they probably wouldn't respond to the census. Other smaller groups like Native Hawaiian, Pacific Islanders, and people of multiple race were at a 61% of filling out the census. And, you know, with Asian American communities, there's kind of this fear about what's going to happen with their data if they do fill out this questionnaire. So a lot of them kind of express fear that they don't think the government, the Census Bureau, would keep that answer confidential, or that they were afraid that the Census Bureau will share that information with other government agencies. And so a lot of this is part of the reason why Asian Americans, Native Hawaiian, Pacific Islanders are categorized as a hard to count community.
To build off of what Julie said, AANHPI communities have a lot of these barriers. So in addition to having limited English proficiency and having these language barriers, many of them are busy with multiple jobs. There's also a sense of apathy. They may have closer ties to their mother country than here. And of course, there's this lack of trust or hesitation in what the government will do with their information. Especially with COVID-19, there's also this fear that by filling out the census, there might be ways that geographic information about API communities may leak. There's been a lot of fear from the racism and attacks on AANHPI communities because of this fear of the unknown and fear of COVID-19. So there's been a lot of rhetoric going around on internet about how some of these communities are hesitant to fill out the census, that people may come to their communities to harm them. So in addition to already these existing barriers, COVID-19 just with this hostile environment created even more barriers and amplified the ones that already exist.
Yeah, and so I think that's where we all kind of come in and kind of be reminded about why the census matters for our communities. And some of the ways that the census does support Asian American Pacific Islander communities is the funding that we receive from the Census Bureau goes directly to public services such as schools, housing, hospitals, healthcare. And we know at this moment hospitals and healthcare is something that is a great need, especially with COVID-19 happening. And so our goal in how we message all of this out to our communities is kind of emphasizing that this money we are receiving from the Census Bureau is going directly to these services that we do need, especially during this pandemic, and in the event that there is, hopefully not, that there is another pandemic in the future, that we have all the resources that we need and all of the money, the funding that we need for these essential programs and services. Some other things that we are focusing on is focusing our messaging around children and emphasizing that the money coming from the Census Bureau is going directly to their school, their housings, their education programs that is crucial to their success as well. For communities with disabilities, a motivator is that the Census Bureau determines the need and funding for medical and special education or special housing and workforce programs. And so what we've been trying to do in light of COVID-19 is highlighting these different areas that we are recognizing we have lack of access to, such as healthcare and hospitals and all of these other things. And so we are trying to highlight that if you fill out the Census Bureau, we will start getting all this money for these resources again, to the full capacity of the amount of people living in California. And that's one of the biggest things that we want to focus our messaging on. But yes.
So moving along to messaging. So there was a census study made that studied what kind of messaging particularly worked with Asian American communities to convince them to participate in the census. And it's found that the family message was particularly strong among Asian Americans, specifically among Filipino Americans, and that this kind of advocacy around family support and resources were really strong. So ultimately, of course, the message around how to communicate to API members why they should fill out the census is directly related to why it matters. So it's important to center the importance of the topic around community members and family and reasons why they should care.
Mm-hmm. So again, with the Census Bureau, besides providing funding for these crucial services that we need, the census data that is collected also determines how many congressional seats each state gets. And after the Census Bureau receives all this information, they're going to use that data to redraw congressional district lines. In 1990, the census was undercounted for California, with about 830,000 people not responding, and that led to California losing a seat in Congress that they were entitled to. And that was estimated to have lost over $200 million of federal funding in just one fiscal year. And because the census only happens once every 10 years, an undercount will have a long-term negative effect on our communities, because then we're losing a lot of this money and this funding that we need for all of the services that we have. And if we lose a congressional seat, then we're losing representation and a voice for our community to express these concerns and needs that we have.
So in addition to congressional seats, the 2020 census is used for the allocation of federal funds. So over 1.5 trillion in federal funds is spread out to different communities. So these include Medicare and Medi-Cal, which of course right now is more important than ever to have adequate health insurance, highway funding, programs like SNAP, Head Start, a lot of these after-school programs, libraries, and hospitals. So a lot of these healthcare services and community services are all funded and determined by the census.
Mm-hmm. And to go back on the fears that exist for our communities right now about that confidentiality, about what's going to happen with their data, and especially with COVID-19 happening, and that fear of what's going to happen if people can look at these geographical heat maps and identify where API communities are and target them. We wanted to emphasize that with the census, it is protected by Title 13. And what Title 13 is a federal statute that has been protected for years. And ever since the Japanese incarceration, Title 13 was strengthened to be more explicit about government sharing information and to protect whatever information that is coming into the Census Bureau. I want to acknowledge that for a lot of Asian American communities, there may be those articles being sent around about like the Census Bureau is bad because they're going to use that information to incarcerate people. That's what they did to the Japanese Americans back in the day. But we want to emphasize and recognize that, yes, that did happen. But ever since that happened, the Census Bureau recognized that that had a negative impact on the ways that our community members were responsive to the government, in ways that they were able to provide these funding for these resources that we need. And so since that happened, they have strengthened it to become a lot stronger and to be a lot more strict in the ways that they protect your data. So some things that comes out of that is if someone does break the confidentiality law of Title 13, then it is considered a federal crime, and penalties are severe, which includes like federal prison sentence or a fine or both. And the idea of the Census Bureau is that whatever information is coming in, there will be no information coming out except for the statistic data that they are using this census data to create. And so just to clarify, the Census Bureau will be taking in information and data from the community and use that to create aggregated statistics. And these statistics in no way can be traced back to any individual or any individual family. And so all of your information coming in will not be sent, like there's no way that anyone can find a way back to you specifically. And so whatever data is going in is going to be strictly protected under Title 13.
So in addition to Title 13, California actually has its own confidentiality law. So under the California Bill of Rights, any false representation to obtain or interfere with the census is a misdemeanor that's punishable by imprisonment and or by fine. So in addition to having this federal statute, Census Bureau understands like the importance of collecting data. So there are very strict laws prohibiting data sharing to anyone outside of the census.
And we wanted to also bring up about the fear around COVID-19 that's happening, the fears about creating a map that might be able to be led back to API communities. And so we wanted to just recognize that in the news there has been people that are sharing that fear. But basically what happens is that the Census Bureau will be collecting information and data from different communities, and they will upload that information onto their database, and you can look onto the map to see kind of general areas in which people have already responded or people aren't responding. And the purpose of this is so that the Census Bureau will know what areas they need to target in terms of sending Census Bureau workers in to explain, or having nonprofit organizations come in and provide that extra support to these communities that are hard to count. But because of COVID-19 and the increased racism and hate crimes happening, people are showing fear that if they answer the census, that these heat maps would be able to lead back to them. But we just wanted to clarify for anyone that may be holding that fear, or any community members that has expressed that this map is just a general area map. In no way can someone look onto this map and pinpoint a specific household or a specific neighborhood that is API community and go there to target them for any reason. And so I just wanted to clarify that if that is a fear that you are hearing about, or that you yourself have, there's no way that your information will be leaked out and people can come directly to your house for any of these targeting or crimes. So I just wanted to put that out there, that your information will be safe, and that the COVID-19 racism and fear shouldn't affect the ways in which people are able to fill out the census. This is also something that a lot of Asian American communities have been afraid of as well. There was this, in the news, they had said previously that there might be a citizenship question on the census. But just to clarify, there will not be a citizenship question at all. The Supreme Court held that the citizenship question was added in an illegal manner because the Secretary of Commerce they didn't have a proper reason for adding the question. And so the administration has confirmed that we will be proceeding without the citizenship question. And so if you wanted to check for yourself, you can go log onto your census right now at my2020census.gov and see for yourself that the citizenship question will not be there. And so the census will not be asking anything about your citizenship status or immigration status or anything like that. They're just all going to be very simple questions that we will go over in this presentation.
Okay, so again, here are some of the messages that resonate really well with Asian Americans and NHPIs. So in addition to family, there includes duty, resources, representation in our elections, and especially like understanding the needs that are needed in their community. Privacy and visibility as an API community is particularly resonant, and especially whatever is most relevant to their family and children's future. And especially the fact that the census is protected by law and then that there is this confidentiality.
Awesome. And again, just to reemphasize some of the ways that you can message the census is recognize where the fear is coming from and where the lack of interest in learning about the census is coming from. A lot of it does stem from fear of whether or not their data is confidential, fear that they don't know what's going to happen with their data that's being sent to the census, and a big fear that whatever answer they give to people or give to the Census Bureau will be used against them. But we wanted to clarify that, again, under Title 13, all of the data coming into the Census Bureau will be confidential. It will not be shared out to any government agencies or any public programs or anyone. All the information going to the Census Bureau stays in the Census Bureau, and the only thing coming out is the statistical data that they are creating. In terms about whether that their answers will be used against them, I also wanted to say that it will not in any way negatively affect any community member or any individual. The Census Bureau wants to emphasize that the census is used strictly to support community members and provide them whatever resources or funding that they need. And so they don't want to do anything that will negatively affect any specific community or any specific individual. And so answering the census will only be able to benefit you. In no way will it be able to affect anyone negatively. And again, some things that do motivate Asian American communities is that funding for the public services. Again, back to COVID-19, with healthcare and hospitals and lack of those resources, we want to use that as a point of messaging for communities to recognize that filling out the census will lead to us having all of the beds that we need or all of the staff that we need and all of the healthcare resources that we need in times like this.
So here we have a census engagement video that we'll share on this PowerPoint as one of the resources. So you can watch this after this webcast. It's really useful just to see some of the methods that are employed to engage people with the census. So again, like some of just the main points when engaging and messaging about the census is to first make it easy to understand, be explicit and very specific about who needs to participate, normalizing the census as something that is just not foreign, not scary, make it immediately relevant to that community individual's needs, especially like Julie said, relating it to the COVID-19 crisis and how the census will help us be more prepared in the next 10 years if such a situation like this arises again. Again, using phrases and terms that are easy to remember and understand for that specific community member so they themselves feel engaged and they're in a conversation. And in addition to these interfacing methods, just having a lot of materials and swag items in a waiting room. I know everyone's working at home right now, but hopefully when we're back in the office or back when we can reduce the social distance, but we can provide these items, reinforcing the safety of the census, emphasizing the ease of filling it out, and just having it as a common topic of conversation.
But yeah, this video will also be sending out to all of you to view on your own, but AltaMed just basically provided a kind of different step points that they've used to address the census with their staff in their daily life, so incorporating that into what they're already doing. And I know all of you may be interacting with a lot of clients and seeing them often. So some things that you can do is just kind of before they leave or when they're arriving to just bring up like, the census is here, make sure you fill it out. And we do have some resources and flyers that we can share with you all to have at your offices if you're in right now to share with your clients about the census. And at the end of the slide, we also have some resources online that you can share out in any newsletters or any community members or families that you're working with to just provide that information about what the census is. Awesome. So some key talking points that they use in the AltaMed video is that ensuring different touch points in which they can engage with their clients and participants about the census. So some things that they did was providing informational fact sheets where they can see them. So out on the sign-in table, they left some flyers and information about the census. In the waiting room, they had some, again, posters and flyers about the census sitting around for people to look at. They offered infographics on their screens, on their TVs in the waiting room, or just provided on the desk. And each person that does interact with the client, whether that be the receptionist or the nurse or the doctor, they brought up the census and talked about what the census is very briefly and talked about why it's important, especially in healthcare right now, reaffirming that right now the census is something that, even though it isn't high on people's priority list, should be crucial in the ways that they're thinking in this pandemic that we're in. And other things that the staff did in the video was providing reassurance on the safety of the census. So again, this goes back to the confidentiality and the security that is within filling out the census. They also reminded them of ways that the census directly affects them, even though a lot of people don't think the census matters. In fact, it really does directly affect each and every single one of us. And so the staff in the video brought up that the census directly affects them in terms of the health care that they are receiving and the resources and funding that they have to pay for all of these things. Some other stuff that they did do was provide paperwork as the client was leaving. And so it would be things like fact sheets on how to fill out the census, where to look up more information about the census, resources to learn more, and the numbers and website that they can look into to learn more about the census.
So here we just wanted to provide the different ways that people can fill out the census in the various languages that are available. There are only 13 online, 14 by phone, and 2 by mail, so they're only mailing out English and Spanish paper forms, but there are 59 different language guides. Here you can see all the different phone, in-language phone assistance that is provided. So these phone lines are open from 7 a.m. to 2 a.m. every day. And so there will also be quacks and CACs available, so questionnaire assistance centers and questionnaire action kiosks. These were meant to be places where people can fill out the census at a safe and secure area if they don't have internet access or if they have limited phone access. But with the COVID-19 climate and situation right now, the location and the status of these CACs and quacks are subject to change. So there may be some in the further future, but for now it is best to just encourage filling out the census online, and if they need over phone assistance by these phone numbers.
Mm-hmm. Some other things that you can use as well is our affiliates have a hotline that you can call 844-2020 for support in English and other languages. And with this hotline, we provide some API languages that folks can call to if they have limited English proficiency, just to provide them more information about the census and any questions that they might have regarding it. So if you or your clients or any of your family members do need this service, it is here for you all to use. And the call line is live now, so you can call it whenever you need to between the hours of 8:30 to 8:30 p.m. in Eastern Time.
So again, with this accessibility, some of the messaging that we've been engaging a lot in is that the census, you can fill it out in the comfort of your own home. So within the comfort and safety of your own home, just go online to fill it out. You can encourage clients to do so either online or by phone. And of course, at a later date, if they need help, attend CACs and quacks. Also, this U.S. Census Bureau also provided these video guides online that show step-by-step in a large amount of languages on how to fill out the census. So actually, Advancing Justice will also be providing playlists on our YouTube channel where we'll also be organizing these videos by language, where you'll be able to find PSA videos and how to step-by-step guides on how to fill out the census as well. So those will also be available to share.
So something that we want to acknowledge in light of the COVID-19 pandemic we are in at this moment is that there has been a rise of racism for the Asian American community, as well as lack of resources existing. So things like basic things, toilet paper and like food and water and a lot of these other resources that people need to survive have been hoarded by a lot of community members. And so we have been hearing around that there's this fraud happening where people are coming to your doors and pretending to be Census Bureau staff to either rob you or to initiate some hate crime or racism or just some type of attack to community members. And so we wanted to put it out there that at this moment there should be no Census Bureau staff coming to your door. So if any of you are facing this issue that people are coming in your door claiming to be a Census Bureau staff, I just want to let you know that that is not true, because the Census Bureau has halted any in-field staff at this moment. And at this moment, they are stating that post April 1st, they might be sending some people out. The details on that currently isn't entirely clear, but at this moment, if anyone is coming to your door and claiming to be a Census Bureau staff, please don't open your door for them, because they will not be a Census Bureau staff. If this is happening for you, please take the precaution and contact the Census Bureau at this number here, just to report that this is happening. We also want to recognize that at this moment there may be some type of tension happening with law enforcement where community members aren't comfortable calling the Census Bureau or calling in any law enforcement staff. And so I put an asterisk here to just kind of recognize that. If there is anyone that is in critical danger at that moment, I recommend calling 911 or just avoid leaving your house and opening the door for strangers, because there won't be any Census Bureau staff. So we also want to, again, highly recommend that you should be telling your staff or your family members to just fill out your census online, just to be in the comfort and safety of their own home and their own space without having Census Bureau staff coming to their door, because we will be going over this later in the non-response follow-up section, but in non-response follow-up, they will be sending a Census Bureau staff to come to your door and have you fill out the census on the spot. And I think with COVID-19 happening right now, a lot of people are feeling like they don't want to have strangers come to their door, especially law enforcement or anyone from the government. And so that's another way that we have been trying to message our census, is that we don't want strangers being in our house and we don't want these people coming in. And so it's better to just fill out your census online by yourself before the non-response follow-up dates come.
Okay, so building off of what Julie said, so what happens if I don't respond to the census? So technically, filling out the census is required by law. It is in the Constitution. But if you don't respond to the census, a census worker will visit your house up to 6 times. To identify a U.S. Census Bureau worker, they will have a badge and they will have Census Bureau materials. If you skip questions on the census, you will still be counted, but they will probably use the phone number that you provided to follow up on any questions that you missed. And they'll probably kind of contact you a few times or also still come to your door to try and fill out that last answer. Just keep in mind that this will cause an undercounted census. That doesn't mean you won't be counted. It's just that they'll be missing that one slot in your survey. But you can skip questions, but it is just to avoid any unnecessary contact. It is better to complete the entire census.
So the non-response follow-up will take place May 28th. So that's going to be the first day that they start this process. And so basically non-response follow-up, like Leanna says, is when they will send a Census Bureau to your door to fill out the census in person. And they can do this up to 6 times. Again, to identify a census taker, they usually will have a mobile device with them that has the Census Bureau logo on it. If they come to your door and you're not there, they'll leave a notice of visit to nudge responses. They won't ask to enter your house, so if you have someone coming to your door asking to enter your house, don't call them. Don't let them in. You can call the number that is on the back of their Census Bureau ID card just to confirm that they are indeed a Census Bureau staff, if that is a fear that you have. The census taker will only ask you questions that's on the questionnaire, so if they ask anything outside of that, then I would recommend calling that number again on the back of their ID card or calling the Census Bureau itself just to confirm. And they shouldn't be asking you for any documentation. Whatever they ask you will strictly be the questions on the questionnaire. So anyone that doesn't respond, do self-response by April 30th, will most likely have a non-response follow-up with a census taker coming to your door. But as long as you fill it out before that date, then you won't have anyone coming to visit your door, or you won't have anyone calling you or anything like that. So I just wanted to put it out there that, again, we highly recommend just filling it out by yourself because it's super simple and it's super quick. It takes about 10 minutes. I did mine yesterday and it was very, very quick. And so that can save you a lot of trouble of having people come to your door or calling you constantly. So we highly recommend that. Something that will happen is that if they show up to your door 6 times but you don't answer them or you don't respond to them, then they might have to use administrative records to fill in that missing data or impute that data. And so basically what that looks like is that they will kind of try to find someone that looks like you, is in the same age as you, in the same ethnicity as you, and kind of just take their data and fill it in for yours. And so we want to recognize that that does take away a lot of your own agency about who you are, and that the Census Bureau actually might just get your information wrong. And so I would recommend just filling it out by yourself in this self-response period, online or by phone, whatever works best for you, to prevent this imputing data happening.
Okay, so just with the final points about this NRFU period, when you identify how to identify a census taker, they will never ask to enter your home. They will always have their Census Bureau badge and carry the items with the Census Bureau logo. They will only ask questions that are on the questionnaire. So if anyone asks about your citizenship, immigration, or financial information, that is not a census taker. And they will not ask for any additional documentation.
So some of the administrative records that they will be referring to might be, for example, your neighbor. They might talk to your neighbor just to get a general sense of who lives in your house, who's there, what your age group is, or whatever, to kind of get that information that they aren't getting from you directly. Some other things they might use is postal services or Social Security or the IRS, just to kind of get a general sense of who you are. And fill out your census for you if you choose to not fill it out. Again, I just wanted to clarify that if they are using any of this information from anyone else other than you to impute your answers, that is still going to be protected under Title 13, and you will still be safe under that. So even though your data is still protected, there is still kind of that part of you not having the agency to fill out the census by yourself. And so I kind of recommend that you just do it for yourself because, again, it doesn't take too long to fill it out. and you really can just do it all. It only asks you 9 questions about your name, your date of birth, your age, your gender, and what your relationship is with like the main household person. And so I think that really with just about 10 minutes or so, you can fill it out really quickly and get it done, just to avoid any of these problems that might arise.
All right, so here we have linked a lot of our resources. So we have the Count in 2020 resources. So those include different AANHPI language fact sheets. So anything about confidentiality, what the census asks you, any of those concerns. We have a whole list of different fact sheets to use. In addition, we also have a list of PSA videos in different languages as well. So those are all linked there, and especially what's really handy are the step-by-step guides on how to fill out the online census. We have the AltaMed census engagement video that we addressed before that shows different ways to interface with clients when talking about the census. And of course, we have the Stand Against Hatred Reporting Hate Crimes site. So if there are any cases of your clients or encounters with hate crimes that are related to COVID-19 and Asian Americans, please help us report it on that website so we can help track. And incredibly important because with the environment that we're in today, everything is changing day by day, week by week, even with census stuff. So these deadlines have been pushed back. So the NRFU period has been pushed back. The deadline to fill out the census was pushed back by 2 weeks. So that's now on August 14th. A lot of these updates that you can find on the Census Bureau COVID-19 updates website. So any of the most recent information that may change from the time that you watch this webcast can be found on that website.
Mm-hmm. Again, so if you do have any questions about the census or anything else, you can feel free to contact me or Leanna at our emails, or you can check our resources online at countusin2020.org/resources. We also have resources for Native Hawaiian and Pacific Islander communities as well, also on that website.
Just wanted to say thank you so much again for coming and listening on this webinar. I can't imagine like how overwhelmed and overworked the health clinics have been. So really grateful that you're able to sit in and listen in on this.
And again, whatever questions you may have that might arise for any of you, please feel free to contact us and send us an email, and we'll do our best to support you in those answers.